Welcome to the Functional Medicine Foundations podcast, where we explore root cause medicine, engage in conversation with functional and integrative medicine experts, and build community with like-minded health seekers. I'm your host, Amber Warren. Let's dig deeper. Okay. Welcome back, everybody. Thanks so much for joining us today, this evening, whenever you're listening to it. I'm here with Shelby Stoddard. She's one of our newest nurse practitioners, local Idaho girl, which I love so much.
Well, last 22 years. I'm from Pennsylvania originally.
You did not have to share that. You've been here for 2 decades. You are my local Idaho girl,
good.
okay?
I'm a local. I love that.
Yes.
I want to be local.
Before we start talking and have too much fun, I'm going to go ahead and just read your bio. So Shelby Stoddard, family nurse practitioner, found inspiration through the FMI email list and FMF podcast, this podcast today, which aligned with her belief in addressing root cause of symptoms. Yay. A committed nurse practitioner, Shelby implements small changes for long-term improvements and has extensive experience in adult cardiology, rural family medicine, and nutritional functional medicine. Her journey began as a CNA in Pennsylvania, advancing through various nursing programs to become a board-certified family nurse practitioner. Shelby has received training from renowned professionals and has participated in FDA clinical research and studies on chronic pain and illness. Shelby emphasizes the integration of mind, brain, nerves, and immune systems for overall well-being, understanding that sickness can result from trauma and toxins. Inspired by Dr. Marcio Amato's water experiment, she believes in the healing power of words and diverse healing practices. Her expertise includes mitochondrial optimization, chronic illnesses, immune system dysfunction, oxygen, ozone therapies, neurofeedback, hormone optimization, and more. Shelby's compassionate approach and dedication makes her a vital part of the FMI team. In her personal life, she enjoys nature, engaging activities like fishing, hiking, snowshoeing, mountain biking, and competing in NRL 22 matches. I don't know if I know what that is. Finding relaxation, enjoying the outdoors. What is that? Have we talked about this?
That is 22, long-range 22 competition.
Yeah, I knew you were a bad Idaho girl. I love it so much.
Yes, my husband got me into that, so.
That's awesome.
It's been good.
Welcome to the podcast.
Thank you.
We're so glad to have you here.
I'm so glad to be here. Thank you.
So, oh my gosh, you're so welcome. So we wanted to spend some time today talking through kind of viruses, chronic viruses, reactivation of viruses, how they impact the immune system, how the body deals with them.
Right.
Because I think it's something, it's kind of like its own little silent epidemic, right?
Right.
These viruses that we're interacting with. And, you know, I think right now you say the word virus as a buzzword and all people think about is like COVID-19.
Yes.
Right?
Exactly.
And
we're forgetting about all the other viruses.
We're forgetting about the tens of thousands, of millions of viruses that we're bombarded with every day.
And we have been for beginning of time.
Yeah, absolutely. Mm-hmm. So let's break it down and start with a little, 411. What's a virus?
So a virus technically is an infectious microbe that has DNA and RNA on it, or is kind of strung up like that, make up like that, and then it's bound by a protein. Okay. And so that's what gives it its like virality, and so you've got a protection. Yeah. And then as it evolves, so then it envelops on itself, and that those little areas of enveloping or overlapping, then that is protected by a lipid. And so then it gets more, that's where things start to get more virulent when you get more enveloping of viruses or overlapping of these virus DNA.
What do you mean by virulent?
So more, you get sicker.
More pathogenic,
more
right?
More pathogenic, yeah,
Okay.
Exactly. More pathogenic, depending on your terrain and what other things are going on with you and those things. But it can be life-altering at times.
Absolutely.
And I think that's what we're seeing, like when you hear the buzz, can I say COVID?
Yes, I already said it. You can say it.
When we talk about COVID-19, SARS-CoV-19, it is a more virulent virus. That we know that, and it's turning on a lot of different things for people that may have already had some issues, like with diabetes and inflammation and cardiovascular disease, and so these things that these viruses release are causing us to be sicker.
Right.
And especially too now that we have a lot of people more in the probably 40s to 60 range that have been on omeprazole or Zantac or some sort of acid reducer for years and years. And I'm just seeing that you're losing your first line of defense. And so we're getting sicker.
Break that down how? So these PPIs, proton pump inhibitors, you just mentioned a lot of the generic names of them.
Yes.
Why are they so problematic for our immune system?
Well, over time, they're good for short term. That's all they were ever meant for. Long term use changes the pH in the stomach.
Yeah.
So it makes you more alkaline. And you have to have an acidic stomach to be able to break down the proteins, so and proteolytic enzymes to get rid of the virus or bacteria or other parasite or pathogens.
Right. Yeah.
And so when that is altered, then those things are getting through to the gut. And so then you have this virus that's, all in its natural form, and then it gets to the small intestine and should be able to be taken care of there, because that's where lipids are more digested.
Right.
But as you take these medications, it alters the pH of the whole digestive tract the longer you're on them. And so you're not getting even your second line of defense, which would be your small intestine.
So that's one root cause of why you think maybe we're dealing with this like viral bombardment, if you will. What are some others?
I think also it has to do with our environment.
Yeah.
So more of like a toxic soup. If we've talked about that before. EMFs, chemicals, pollution, more people. I mean, that's in general.
Yeah.
And our food, too, our food sources. So, yeah.
So what viruses, let's dig into because there's a lot of viruses we can test for. Like when someone comes, we can go a lot of different directions here. So we look at in functional medicine, you and I have talked about this, viruses being like a root cause of autoimmune disease.
Yes.
Hashimoto's, rheumatoid arthritis, lupus, multiple sclerosis.
Yes.
And maybe even some more inflammatory disorders, not just full-blown autoimmune diseases.
Yeah.
What do you think as far as these viruses? What are the most common offenders? At least the ones we can test for, because a lot we can't test for.
Right. I would say the most prominent one that I have experience with and have tested for is Epstein-Barr virus, or like the virus for mononucleosis.
Known as mono, yeah.
So a lot of patients will you say, well, have you ever had EBV, Epstein-Barr? And they're like, well, no. But and then you say, well, have you ever had mono? And they're like, oh, yeah. And I'm like, okay. Yeah. And then you kind of explain that because, it's just something that we're not all familiar with, right?
Yeah.
But yeah, then looking at that, Epstein-Barr panel, so looking at more of an acute infection. So you look at, different a protein for that, and then or antibodies, and then you look at a different way you look at it to see if they've been exposed to it. And so there's our school of thought saying, well, if you don't have an acute infection, so those antibodies are low, IgM markers are low, then you don't have an infection. But yet you're also having all these thyroid issues, hypothyroidism, hyperthyroidism, your immune system's off, your white blood cells are low, your lymphocytes are low. And so you look at their chronic markers and they're sky high. And so I believe that even though it's a past infection by definition, it still causes issues today. So it's turning on a pathway for immunity, or for these things to turn on thyroid disease.
Right.
And it's based off your immune system, whether it's acute or chronic, especially with that one. Maybe there's other ones that may be how it really presents itself. But with EBV, I feel like it doesn't matter if it's acute or past infection markers, you have to look at it all.
And do you think with Epstein-Barr, do you think it's just that it's more studied, or do you think it's more prevalent? Because there is definitely more awareness of that virus. Like you go listen to any health podcast, and EBV is talked about a lot.
It is talked about a lot, but we have a lot of thyroiditis right now.
We do.
Especially since 2020. We have a lot of things that are going on since then, but I just really feel that even before that, if you look at people that would come in with thyroid symptoms, if you look at that panel, which we didn't always do in the past,
right?
You're seeing it more and more.
You're seeing more of those chronic markers.
Yes, you're seeing chronic markers, and it likely is because we are testing for them.
But
the symptoms the symptoms, even if you look back in the history of symptoms,
not the same.
Not the same.
So there's this, and we talked about this a lot during COVID, right? That this concept and the argument, it's pretty controversial, germ theory versus terrain theory. And you're saying it's really kind of both.
Yeah.
We need to evaluate both. The germ is important, whatever germ that is. In this case, we're talking about EBV.
Right.
But you listed all the reasons that terrain allows the germ to become that much more of a problem.
Yes.
Do you think I'm saying that right? Would you agree with that?
I would totally agree with that. So why, a reason why it could happen, but then looking at the terrain as to how it's moving through. So it's passing through the gut, those inner layers of the gut lining as they get inflamed because of other things, then those viruses have they're more permeable. So and there's bigger holes for them to come out. And so they get into your system.
And that's when they really start wreaking
Yeah.
havoc.
And that's when they start wreaking havoc.
You think they wreak havoc when they hang out in the gut?
I don't think they cause as much havoc.
Okay, I would agree, but I'm putting you on the spot here.
Yeah, that's
but I've
okay.
never really thought about that. But.
Yeah, I don't feel you see as big of issue with people if their gut is healthy or not permeable or inflamed.
I've talked about this a lot on our podcast, and I think we get into trouble because I think we have patients that come to us asking for that one. What's the one reason I can't lose weight, or what's the one reason I'm so tired? And a lot of times you will include like some of these viral panels in your initial workup.
Yes.
And yes, some of the more chronic IgG, IgM markers will be high, but that might not be the one thing. It might be part of this.
Yes,
this
it's
puzzle.
definitely part of it because the longer that is looked at, then there's other things that come along with that too. Or is it something else coming along first and then stimulating this? Sometimes we don't know that, but that's why we get all that information so we can put the pieces together.
Yes.
So a lot of times it's more your generalized inflammation, or they have metabolic disease, meaning insulin resistance, or type 2 diabetes, or cardiovascular disease, endothelial dysfunction. They're not sleeping, so their oxygen's super low. Then low oxygen then leads to, things happening in the blood cell themselves.
Yeah.
So you have these viruses that are causing issues, and then you have all these other things that are making that even more virulent, and then your cell energy, your mitochondria of the cell, is not as optimal, or sometimes it's just there barely.
So let's talk about that, because I think that's another thing that's not talked about enough in medicine, but even functional medicine, right? Mitochondrial toxicity. What are mitochondria?
So mitochondria are the powerhouse of your cell. So they're like the little nucleus in the cell, little nucleoids, or correct term.
Yeah, for sure. Yeah, I'm so proud of you.
Go in there, and that is what causes or helps your cell have energy. If you don't have mitochondria functioning in your cell, you don't have energy. And so, also, if the integrity of your cell is off, which happens a lot with chronic illness and viruses and chronic inflammation and diabetes and all those things, then the cell integrity is lost, and so you're losing that even more ability for that cell to give you energy.
Right.
So there's all sorts of different processes and proteins and molecules that play a part in that mitochondrial function, but any one of those pieces that's disrupted interrupts that energy of the cell. And that at the basic level, that is why we get tired.
And that's and we know viruses, any kind of a virus damages the mitochondria.
Yes.
Okay.
Yes. And the more virulent, the more damage.
I was going to say, how do we know which ones are more damaging, more virulent, more pathogenic?
And you have to do a lot of testing and do all of those. But I feel like as we evolve more, our viruses are more virulent. That's what we see.
Another, I think, controversial topic: testing for mitochondrial damage, toxicity.
Yes.
Do you think we have good tests to be able to assess a person's mitochondrial health?
Well, you look at someone's oxygen level. So
that's
pulse
true.
oximetry.
Good point. Yeah, that's true.
I would love everyone in their house to have one. And to, when you're doing things and you're feeling short of breath, or you're feeling just run down, like, what is your oxygen doing?
Yeah. And that is actually very telling on why obstructive sleep apnea is so damaging to the body.
Yes.
Because you're spending a third of your life not adequately oxygenated.
Yeah.
It's mind-boggling how hard it is to get people to test for sleep apnea. I'm like, no, you don't understand. This is if you have it, I can't miss this as a diagnosis.
Right.
Like, this is a big deal.
It is a big deal. And if you're not getting that reversed or corrected, you can only do so much, even with nutrition therapy, medications, IV therapy, all these things.
Yeah. And then if your oxygen's in the tank, what do we know that's high?
Yeah.
Cortisol.
Yeah, exactly.
And we know what cortisol does to the body, into the brain, into the mitochondria.
Right. It just alters it even more.
Yeah.
Like, you're just losing all these protective mechanisms. So
So someone comes to you with a new diagnosis of Hashimoto's thyroiditis or an old diagnosis that you recently caught.
Yeah.
Because we know it's one of the two, right?
Right.
You find that they have astronomically high markers
Right.
indicating a chronic or a reactivated, which we should talk about also the reactivation of viruses.
Yes.
How do you define that?
So you're looking at, well, it's a little bit, sometimes it's a little hard because they don't have a lot of history of those IgM and IgG markers.
Yeah.
So you're looking at, I would say that if it's a reactivated virus, you go by symptoms and then you go by the IgG response.
Okay.
So if it's high, then I would say it's a reactivated virus.
I would agree. So we know these viruses can lay dormant and not really cause issues.
Right.
Right? Kind of like parasites or H. pylori or other things that we
herpes
find
virus.
in the gut. Herpes
This is
virus.
it.
Yes, true.
Yeah.
Not necessarily causing issues, but we know
No.
someone gets stressed, herpes outbreak.
Yeah.
Right? The virus gets reactivated and make itself known in your body.
Right.
And all of a sudden becomes a bad player.
Yeah. I
So-
think that's just a good thing too to remember is like viruses, they lay dormant.
Yeah.
So that's just how it works.
Yeah.
And so if we're saying that they can never be reactivated, I don't feel like that's truthful.
Yeah. I would agree.
Yeah.
So back to the clinical case scenario.
Yeah, sorry.
So no, this is great. I come to you, new diagnosis of Hashimoto's.
Okay.
You find these really high antibodies on a viral panel.
Mm-hmm.
Where do you start? That's a loaded question because there's probably, you have so many other questions on what's going on with that patient, I know. But what are other things you're looking at before you would just say, let's go kill, seek, and destroy?
So we're looking at symptoms. So, what are they, how are they eliminating? So bowel movements, what's their hair like? What's their energy like? What's their stress level been like? Are they been around any new environmental factors? Any new illnesses? But then if everything, is sort of all pointing to it's Hashimoto's, we're looking at the immune system, and we kind of look at and see, we really look at the balance between T3, T4, and then also reverse T3.
As far as the thyroid panel.
As far as thyroid panel.
Yeah.
And then how that and then the thyroid antibodies, so TP antibodies, antithyroid globulin antibody, and see how high that is too. But sometimes you can have a Hashimoto's where that's normal and still have a high EBV, which that is can be mind altering as well.
Yeah. That's very confusing.
Yes. But you have to look at trends.
Yep.
And know that not always when you test that they're going to be high, and go from there.
Yeah. And that's where kind of the magic of functional medicine, you're just casting a wide net. No stone left unturned.
Yep.
Right? So treatment, how do we set up the body to not only fight these viruses, but also be preventative, right? We really, I talk about that a lot with gut cleaning and parasite cleansing. Let's make sure all the work you've done doesn't become undone.
So that's where we would get looking at medicines. So if they've been on omeprazole or Zantac or PPIs, anything that's kind of changing the stomach pH, we want to change that. So we want to wean that off of those, and we can do that by cleaning, doing some gut health support with nutrition, and we can wean that off. And then we want to do nutrition support. So that's where we bring in nutrition, which is amazing. We have that here.
We have a great team.
Yeah, we have a wonderful team.
Yeah, good.
Because a lot of times we want to avoid those immune system stimulating things that we're eating or around. We're doing pH balance, so stomach health, and we're doing nutrition. And we're doing balancing the TSH. Do we need to add any medications?
Good.
Maybe not. But we can do a lot with supplements too. So adding thyroid tissue, adding some L-tyrosine, L-theanine, different things to help with the thyroid support. But you wouldn't necessarily have to go right to medications.
Right. Do you think I get this question all the time, I'm sure you do too, because I do think a lot of patients need thyroid medication.
I do
Their
too.
T3's in the tank.
Yep.
They're symptomatic. They're frustrated. They've been fighting this for years. But the biggest question I get is, will I have to be on it for life?
I don't necessarily think you have to.
You don't. You think that your own endogenous T4 to T3 conversion continues to happen, and you just continue to try and support that and find root cause.
Yes, and also supporting the liver. So nutritionally supporting the liver with supplements, rather than, you're not doing medications, obviously, but supporting the liver nutritionally with nutritional support, because that helps with your T4, T3 conversion. And helping also reduce the amount of reverse T3 that's not active. That's not your active T3 form of energy on the cell. It helps get rid of that. It helps that kind of like thyroid resistance. By supporting the liver.
So that's an important tidbit. Like, our community, our listeners need to know.
Yes.
Go see someone that's going to get a full thyroid panel. Because I'm blown away how many providers are just looking at a TSH.
Yes.
Or even just a TSH and T4. It's half the panel, but you're missing.
You're missing so much.
Your body has to convert not only, thyroid stimulating hormone isn't actually it's a pituitary hormone.
Yep.
The thyroid gland has to make T4, but more importantly, that has to get made into T3 because that's what acts on your cells.
Right.
And the individuals that don't even check a T3 on these patients that are wildly symptomatic and just missing that component. Oh, no, because people can feel so much better and their cells can work so much better.
Right. Yeah. And then too, looking at the liver terrain, looking at their gallbladder, like can everything be cleaned up? And can it, because if the thyroid or if the liver is congested with a bunch of lipids and cholesterol and all these different things that are toxins and, what's going on there, then
what's one of your favorite supplements for liver health?
I really like Liviplex.
Ooh, I haven't heard of that one.
From Standard Process.
Oh, cool. Okay.
Yeah.
Good.
So whole food, nutrition, I've used it for a long time.
Good.
I know we have a lot more other things that
There's
we can do.
There's a ton of liver support, yeah.
There is. But it, as my go-to, Liviplex. Yeah. And even too, depending on what's going on, even adding some liver tissue, so hepatrophin helps with that too, and then thyrotrophin and all those things, tissues that help balance the thyroid and the liver, and you wouldn't even need to write a prescription.
Yeah, I love it. So if you are going to write a prescription because that patient is just desperate or their T3 is 2.2, in the tank, which I digress a little, but it is really difficult to see a T3 even close to optimal levels anymore. Even just over, Shelby, I don't know if you've seen this, but even just over the last year, the low T3s I'm seeing.
Yes, low T3s, high insulin, fasting insulins.
And you're right, maybe that's it. Maybe it's just an inflammatory response.
It could be because more kind of delving into that, I think we're just so like pro-inflamed and like, so, what does that mean? Well, that just means that you're not having really good immune function, or like our immune system is meant to take care of all the dead cells too, or even half dead cells that our bodies naturally do. That just is a red blood cell lifespan, right? But if you're not having that, what they call good apoptosis, you're getting rid of those cells. Those, half dead cells, for lack of a better term, are producing
zombie cells.
Zombie cells. There you go. It's a real thing, and so they're producing all these other toxins that then turn on all these other inflammatory markers. So I feel like, and then low oxygen on top of that. So
snowball effect.
It's the snowballs.
Yeah.
So there's no wonder they're having all of these high resistant type things happening in the body. And so where do you start? Well, gut, looking at the one that's most prominent. Maybe it's thyroid.
Yeah.
And then treating that and going from there.
Cortisol
is done.
Stress.
It's huge.
I know, it's so significant.
It's so big.
And that's such a hard one because just the society and the world we live in and the go and the distractions and just to get people to calm down, it's really hard.
It is hard. And it's very hard for people.
Yeah.
And even as for me too, like sometimes you're just going and you're like, what is going on? Why am I so,
I know.
And it's like, oh, well, I didn't go for a walk. I'm not eating right.
I didn't breathe today. Right?
I didn't what?
I didn't take a deep breath today.
Yeah, I didn't take a deep breath.
Breathe.
Exactly.
Yeah, I didn't. Yeah, you're right. I didn't step outside.
Yes.
Shame on me.
So
I didn't fuel my body with the right things.
Right.
Yeah.
It's, no one's perfect, and
we
get it, and we all need help. And so I'm really fortunate to be here and be able to help that too. So
we're so glad to have you.
Yeah.
So, I think we digressed again 4 times, but
I think we did too, but that's okay.
Well, I was back on, because I really do want to know. I don't know your answer to this. If you are going to use, I went to the really low T3 levels we're seeing in our clients.
Yes.
If you are going to choose to use a medication to get them euthyroid and replete that, to get them feeling better. And I think there's decent data too on getting somebody euthyroid and how that can slow the progression of antibodies. I know that can be controversial, but I'm like, I see it. If we get them their thyroid balanced, we do start to see the slow, although we're doing so many different things that what's actually working. But what medication would you choose to do to replace your patients? What are some of your favorites?
So I like Armour Thyroid because it's got, T3, T4, the great, or the normal, or it's like our body's
normal ratio.
Normal ratio.
Yeah.
Oh, I can't say that.
Yeah.
I like NP Thyroid. It kind of is the same thing. And I also like when pharmacies, we have the bioidentical, like T3, T4, where they compound it.
Compounds, yeah.
I like that too, because then you can just really know what you're getting.
Yeah.
And there's not a lot of fillers to it.
Yes, I love that. You can be really specific.
Yep. You can be
and some
super
of our
specific.
patients want to avoid the porcine. Like a lot of our patients like to avoid the animal products. So that's another way, because the NP and Armour, as much as I love them, they
are animal products.
Yeah, they're animal based.
And even too, like the standard processed thyrotrophin and stuff, that's, animal tissue.
Yeah.
So if you're averse to that, that's fine. And you just get it compounded.
There's other options.
Yeah, there's other options.
What do you think are the problems with the synthetic thyroid replacement on the market? The Synthroid, the levothyroxine, even the leothyronine. What do you think?
I just feel like there's too many fillers to it.
Yeah. And gluten and dairy, by the way.
Yeah.
The amount of patients that are like, I avoid gluten. I'm like, we're on a medication that has gluten in it. They're like, what? I'm like, I know, I hate to tell you that.
And that's the thing, like you gotta just educating patients.
Yeah.
Like, I don't know. I mean, if some people are been on it and they're doing great, like, no problem.
Don't pull the rug out from underneath them. Absolutely.
Exactly. Don't be like, oh, well, that eventually it's not going to work for you.
Yeah.
We don't know that.
Yeah.
But we'll cross that bridge when we come to it. But if they're fine and stable, happy to help them with that.
Are you tired of cookie cutter health that doesn't address your unique needs? It's time to discover functional medicine care designed to help you flourish. At FMI, you'll have access to a range of benefits tailored to support optimal health and longevity. Experience the power of personalized care and take control of your health with an annual membership at FMI Center for Optimal Health. Visit fmioptimal.com/membership today to become your absolute best.
I think you make a really good point. And I don't want to get too political here, but it's the fillers and toxins that we see in these manufactured medications and in big pharma. And we think that it's no big deal, but when you're on a medication and you're taking 1 tab twice a day or 3 tabs a day for 20 years, that can be pretty significant.
Yeah.
With some of these dyes and fillers and stuff that are in these medications. I think you're spot on. Like, we wouldn't necessarily encourage you to go have 3 glasses of wine every day.
Right.
Right?
Exactly.
As far as what it does to your liver and to your system. But we're popping pills or popping NSAIDs, over the counter stuff. Let's not even talk about pharmacological stuff. Let's talk about over the counter stuff.
Right.
That is really wreaking havoc on our bodies.
Right. I agree. And that's where I think my passion for getting people off PPIs that have been on them for a long time is because they're over the counter, so they think that they're no
so
big deal.
Accessible. I know they do. You're right. They acknowledge because they're over the counter. They identify with the fact that it's probably totally benign, and they're not.
Right. If I can get it over the counter, it's fine.
Yeah, you're so right. But they were never intended for more than 14 days of use. Let's be honest.
Exactly.
Never.
And it's still that way. If you look up at I'm gonna order omeprazole. Well, it just says 14 days.
Yeah,
that's it.
I know it does.
So anyway, it's just another digression. But there is also I really like using for the immune system and helping balance thyroid, balance any sort of real immune system problem when you have a gut issue or a pH is off, is using IV therapy. So intravenous therapy.
Yeah, you're very educated and well versed. You actually taught a training session for some of our providers a month ago, and you were fabulous. So helpful.
Thank you.
I learned so much.
Yeah, I love IV therapy. I don't necessarily feel like people need to do it forever. I don't want them to be dependent on IV for their whole life.
We don't want them to be dependent on anything.
No,
right?
Right.
Yeah.
We want your innate body. We want your body to innately work. Like that's our goal.
Yeah,
our
it's
goal
beautifully
is,
designed.
Yes,
let's let it do that.
And that's the thing I love, because we're not here just to, suggest these things to take your money. We're here to help you.
Yeah.
We don't want you to be on these things forever if we don't have to.
Absolutely.
But there also has to be some work on the patient's side too. And so, however that looks for them is fine, but we're just here to guide them. So IV therapy, I love for the immune system too, because IV therapy, so especially like vitamin C, it's an electron donor. So it's gonna help attract things that shouldn't be in the body, and it's going to help take it out. It's like your natural. Everyone needs vitamin C.
I would agree.
Some people have, if depending on dose dependent on vitamin C, they might have an adverse reaction. But you can do blood tests to check before you do it and see, and then you adjust dose accordingly. But it's a super good thing for immune system, and to help even balance that Hashimoto's if you're having a flare up or a reactivation.
I love that.
And then doing even vitamin C with some ozone therapy. So not ozone like in the air, but pure O3. So 3 oxygen molecules together. Once it's in the body, then it breaks down into O2, which is oxygen, which we need because we've got this chronic hypoxia, right? And then the other molecule will go and pick up things that should go out of the body. So these half dead cells, it'll help help get rid of them in the body.
So ozone helps to clear the zombie cells that are just drivers of inflammation.
Yes.
So then everybody needs ozone too, as well as vitamin C.
Yeah. So do a little ozone therapy. Follow it with some vitamin C. Amazing.
Yeah. So cool. So you're using a lot of that in your practice, both ozone and C.
Yes.
And you see good results.
Oh, amazing results.
Really?
Yes. It's not a one and done thing. You want to do it, for 5 to 10 treatments up front. And then after that,
Like a maintenance plan.
and then you want to do maintenance.
How about phosphatidylcholine for detox? Do you use a lot of that?
I don't use a lot of that.
Okay.
I've had experience with it. I just haven't used it a ton.
Well, probably because ozone's so much more powerful.
Yeah,
That's probably, you use so much ozone that you probably don't see a huge need for that.
Right. And that's the thing, like over the years, you're trying all these different things, and I'm not opposed to, trying things as long as it's not harmful, but I just seen the benefits of using, ozone for treatment. So not only IV, but other ways you can do it. And it works so well.
So what are some of the other modalities? What are the ways you're using ozone in the body?
So you can do ozone. You can have ozone water. You can make ozone water and drink it. So that would be that's another good way to help with the gut healing. You can use ozone in the ears and the nose for sinus infections. So doing a few treatments like that really cleans up your sinus, especially if you have chronic sinus issues. And then doing ozone vaginally for vaginal health.
I've heard incredible testimonies.
It helps with libido. It helps.
It helps with libido?
Yes.
How?
It helps to oxygenate. It helps oxygenate the vaginal vault.
Okay.
So then you're just getting that mucus. So the Bartholin glands are just getting more secreted, and in those enzymes that are there, it just transfers to that gut brain barrier. It helps to stimulate that libido again.
That's amazing.
Yeah, because it will help. Like it'll help the pituitary. It also will help the liver, so it helps to clean out that liver. So you're getting that detox. So whether you do it vaginally or rectally, you can do it rectally.
Yeah, rectally it's more potent, right? If you're doing it rectally for
Rectally is
gut
more
health.
potent for liver if you want to really help support the liver.
That makes sense.
It has an affinity for the liver, and there's not a real clear answer as to why that is. They just, in all the studies and the way they've tested and stuff, it's that way.
So do you use rectal ozone for a lot of your detox protocols?
Yes.
Oh my gosh, so cool. I have so much more to learn from you.
Yeah.
That's amazing.
Yeah.
So amazing.
Yeah, we could do a whole week's worth of ozone.
And we will. We will.
Okay.
Let's plan it. So so back to the virus and the autoimmune connection, IV ozone. You're doing that for Hashimoto's. You're doing it for these chronic viruses.
Yes.
And seeing really good results with that.
Yes.
So how is it killing the virus?
So it helps to, what it does, it helps to envelop the virus.
Okay.
So, what we talked about before, kind of all these envelopes, it'll help envelop that virus, and then it allows your immune system to kind of get rid of the virus itself. So it kind of creates more of a apoptosis for the virus.
That makes so much sense. And same thing, you need to do some back-to-back treatments to get success with that.
Yes.
So are you putting people on liver support and other supplements while you're doing these ozone therapies?
Yes.
They probably
a lot
need
of
that
times
other-
we're starting with supplement therapy and then working our way into ozone.
Cool.
Or IV therapy.
That's so amazing.
Just so your body, once because you're going to recreate a response. If you're doing higher vitamin C and you're doing ozone, you're going to create an immune response, or it's what you want.
Absolutely.
But people are like, or patients are kind of like, oh, I don't feel good. Well, we talk
part
about
of it.
that. You're not going to feel good.
Yeah.
But we're going to do these other things first to help mitigate how awful you feel.
Yeah.
So
that's great. Yeah, I think it's interesting, just to think out loud here. We talked a lot about like how Epstein-Barr, you've seen it as such a virulent issue and virus in the body. But the more I think about it, the more I'm like, well, that's a great one because we do have some pretty sensitive testing we can do for that virus. But inevitably, if that one's awakened or reactivated or pretty significant in the body, guaranteed there's hundreds, if not thousands of other ones. And so those treatment protocols we're putting patients on are going to take care of the other reactivated chronic viruses as well. And really toxins as well. I mean, it's kind of a one-stop shop.
Exactly.
Like I tell people when you're putting someone on a mold detox, because that's another whole issue and a whole other separate podcast. We've talked about that a lot. But when I'm like, hey, we're going to focus on mold because it's such a bad bugaboo. But inevitably through this protocol, we're going to kill heavy metals and environmental toxins, finally get that glyphosate out of your system that we all need to work on. So it's, it's kind of a one-stop shop when you really talk about kind of the protocols you're probably using.
Yeah, it's an amazing thing. And too, like sometimes people want to know what virus it is or what their numbers are, and that's fine. Yeah. It just costs a lot of money to get those tests, right?
Yeah, to give them the very specific.
But I'm happy to do that. Yeah. It's just...
I am curious, Vibrant Wellness, they're a company, I think I can say specific names. They're a company, we do a lot of toxins and different testing through them, nutrient deficiencies and stuff. They have a viral panel that I've ordered a few times. Have you seen that?
I have not seen that
Go
yet.
look at it. I'd be really curious to get your thoughts. It captures, there's probably 35, 40 viruses on that.
Okay.
And instead of doing it in the blood,
separately.
getting all the IgG, it's interesting. It's like a panel. And I think it would probably make it more affordable than having to check it.
I would, yes, I'm going to look at that. Thank you.
Look at that, Vibrant.
Okay.
Take a look at their panel because I'm curious.
Okay.
I haven't ran it enough to really have a good sense on it, but I'm very intrigued by it.
There's another panel too that, since we've talked about mitochondrial support, is through diagnostic, Mosaic Diagnostics. Okay. It's the mycotoxin panel with mitochondrial dysfunction evaluation.
No.
So I've really been delving into that lately, and that's going to be another test that I'm going to be looking at a lot.
Okay, share some of those results.
Share some results and see how that kind of plays out with symptoms and how it helps, treatment and stuff too. So
that's so cool. Yeah, I mean, when you talk about testing for mitochondrial damage, right? Like, running these tests, looking for mold, looking for heavy metals, looking for viruses, looking for nutrient deficiencies, checking cortisol through your saliva or your urine. Like that's right there. We can look at it kind of in a secondary way. Yeah. You are so wise and so brilliant. And you have such a kind, compassionate heart. And it's been so fun to spend time with you as you come and practice with us. So thank you. Thank you for sharing your knowledge. Yes. We'll get you on for part 2. Let's dive deeper into the IV therapy ozone things. I think there's so many tidbits there.
Let's do.
But we're excited for you to bring that added kind of side to our practice.
I'm excited to bring it to share it and help people feel better.
Oh, absolutely. Isn't that what we're here for?
Yeah.
Help them regain their energy, their life, their vitality so they can be the best version of them.
Exactly.
At work, at home, with their spouse, with their loved ones, with everything. Yeah.
I love it.
It's awesome. Thank you, Shelby.
Thank you. Thanks for having me.
Of course.
Appreciate it.
Thank you for listening to the Functional Medicine Foundation's podcast. For more information on topics covered today, specialties available at the FMI Center for Optimal Health, and the highest quality of supplements and more, go to funmedfoundations.com.